How will mandatory privacy breach reporting affect you? In May of 2018, the province of Alberta proclaimed mandatory privacy breach reporting amendments to the Health Information Act, or the HIA. Custodians will be required to report privacy breaches with risk of harm to the Office of the Information and Privacy Commissioner, or the OIPC, and the Minister of Health. Now, currently, privacy breach notification is voluntary. This new mandatory privacy breach reporting will impact all custodians, including physicians, chiropractors, dentists, dental hygienists, podiatrists, midwives, optometrists, opticians, registered nurses, pharmacists, and more. So today we're going to talk about how we're going to manage a privacy breach. So the custodians must report a privacy breach if there is a risk of harm to the individuals, and the affiliates must report a privacy breach to their custodians. Mandatory privacy breach reporting to the regulators, to the OIPC and the Minister of Health, will help to ensure that the breach response and notification is comprehensive. A central oversight with the OIPC and the Minister of Health will provide the opportunity to anticipate any additional risks of privacy and security within that broader healthcare system in Alberta. The importance of securing the health information and to appear to appropriately respond to that privacy breach is one of those desired outcomes of the new mandatory privacy breach reporting. So the new notification requirements require a privacy breach report to the Commissioner's Office and the Minister of Health and the individuals affected by the breach. Now, there may be other people that you need to notify, and that hasn't changed. So you might need to report it to the police, your insurance company, the CMPA, and a variety of other folks. So that will be dependent on the nature and the type of the breach and the circumstances. But the new regulations require privacy breach reporting to the Commissioner's Office and the Minister of Health. Now, the interesting piece with this is that the regulations have not yet been made available from Alberta Health. So we don't know exactly what are going to be the triggers for privacy breach reporting and how you are going to report that privacy breach. However, we do know under the legislation that if you fail to report a breach, and fail to take reasonable steps to maintain the safeguards, that the custodian could be liable for an offense of $50,000 fine. So we know that we have to do privacy breach reporting, and we don't know all the details yet. What triggers a privacy breach notification? Well, we can make some pretty good assumptions now to be able to anticipate and help to prepare for this effect in August. So if there is an intention to steal specific information for financial gain, we can make a pretty good assumption that that needs to be reported to the Commissioner's Office. If there's been a theft by employees or visitors from the business, then we can guess that we need to report that too. If there's been a snooping or malicious access to the information, or that there's been a large number of persons affected by that privacy breach, then we can anticipate that we need to report those privacy breaches to the Commissioner's Office and the Minister of Health. Now, if there is an individual event or a one-off incident, or perhaps an oops or a mistake, then I'm not so sure yet whether or not we need to report those to the Commissioner's Office. But we do need to monitor and manage that within our organization. So those individual events we need to record, and the big ones too. But when we start to record those individual events, we might see that there is a pattern of similar breaches, and those patterns may indicate a broken workflow, an automated process, or carelessness or disregard of security of personal information, and that probably will need to be reported to the privacy officer and the Minister of Health. So while we're not sure yet what those triggers will be, and the Minister of Health will be releasing the regulations that will give us a better idea, what's going to help us the most is the examples that the Commissioner's Office is going to be releasing about what type of information got reported and how it should be managed on a go-forward basis. So you're going to have to stay in tune to what information needs to be reported, and we'll learn from examples from everybody. When we manage a privacy breach in your organization, we need to be transparent, approachable, and consistent. So these are really big pieces that you need to have in your privacy breach management program. We want our custodians and affiliates and our patients to understand that we believe in privacy and confidentiality of health information, and that we will take reasonable steps and safeguards to protect the security of personal information of all kinds. Now, we also understand that errors and honest mistakes happen to all of us. We need to be approachable so that people feel comfortable to bring these situations to our attention as soon as it happens, so that we can spot it, stop it, and manage that breach. And we need to understand that we need to address a privacy breach each and every time that it happens. So every time that there is a privacy breach, expect to fill out a privacy breach form. That's something that you need to do internally, and then you may need to report that to the Commissioner's Office or the Minister of Health. So to help you about creating your privacy breach discipline process, I'd like you to consider about how you're going to administer discipline for privacy breaches. So there needs to be some types of sanctions, and it needs probably to be consistent. It needs to be fair. It needs to be reasonable. And it needs to be enough so that it's a deterrent, so that it doesn't happen again, or somebody else thinks that they can get away with having a privacy breach and no bad thing was going to happen to them. So whether or not it is your front office receptionist, your clinic manager, your physician, or your pharmacist that releases the information in error, we should expect that there will be sanctions about managing that privacy breach, that it will be fair. If I'm working in a clinic and I send out 100 faxes a day, I am probably going to have a privacy breach with faxes. It may not be something that I may have misdialed that information. I may have sent information to a fax number that was given to me and I dialed it correctly, but it was the wrong fax number. So we need to make sure that people aren't afraid that if they send a fax to the wrong person, then it means that they're going to get fired. It means that they have to fill out a report, we'll work on it together, figure out what happens to prevent it from happening again. So when you talk about building your discipline procedures, I hope that you would consider these privacy breach discipline principles as part of your practice. Now, your privacy breach management program probably is going to contain each of these 5 steps. You need to have a privacy breach management policy. You need to have a response plan. You need to have training in your organization so that people know how to recognize privacy breach. And then so some of those people in your organization know how to implement and respond to a privacy breach. So there's different levels of training for different people depending on their roles in the organization. You need to have a discipline policy. When you get a call from NetCare telling you that they have proof that somebody in your organization are looking up themselves in NetCare, is not the time to figure out what are you going to do next. You need to have that discipline policy in place before you're dealing with those privacy breaches. And that privacy breach can happen tomorrow, so you need to get these policies in place today. You need to have a way to record all of the reported privacy breaches, all of the ones that are reported within your organizations, and all of the ones that you report to somebody else. Now, if you have a privacy breach in your organization and you look at it and you figure out what happened and you say, well, this was a privacy breach, but I don't think it's big enough, bad enough, or important enough to report it to the Commissioner's Office for whatever reason, you need to make sure that you are recording what those reasons are. So you need to have a defensible situation to say, we noticed it, we did these things, and we chose not to report it for these reasons. So that's also a requirement of the legislation. Now, we talked earlier about the biggest mistake in managing a privacy breach is not recognizing the privacy breach. Well, the second biggest mistake is not knowing what to do about it. So we've talked today about recognizing a privacy breach and being able to identify whether or not there is a risk of harm to that individual, and some of the steps that you need to consider so that you can report that privacy breach. Now, if you need some additional help with your privacy breach management program, we do have an online course called the 4-Step Response Plan to Prevent Privacy Breach Pain. So I'd like to introduce this to you. So this is an online education with quick and helpful content so that you will properly manage a privacy breach. And it includes templates for policies and procedures and discussion groups so that you can customize those policies and procedures for your practice. Now, this course is online. It's called the 4-Step Response Plan, and it's available now and has been for a couple of years. I'm updating the course information about the mandatory privacy breach reporting requirements as they are announced from the Minister of Health. So because they're not announced yet, I haven't got them in the course. But the course does include your policies and procedure templates so that you can develop a privacy breach management program now. And when the mandatory privacy breach reporting rules are available as the regulations, then I'll update the course and you can update your policies and procedures as well. So there are 6 interactive lessons, there are video instructions, and of course there's an online discussion group and access to me so that you can get some feedback to answering the questions that you have in the course. The course is available to you online, and you can work at it at your own pace, and you can go back to it over and over again if you need to go back and tweak things as you're managing privacy breaches in your organization. So to get more information about the course, you can go to the website informationmanagers.ca/4-step. So when we know better, we can do better. And I hope that today that our presentation has helped you to be better prepared to manage a privacy breach in your organization, both today and when the mandatory privacy breach reporting comes into effect in Alberta for August 31st of 2018. So I hope that this has helped you to manage that privacy breach. And I would like to hear from you about what you learned today. So if you can enter in your chat button about what you learned today or one thing of value that you learned today, I would love to hear about that from you. I also want to challenge you to take action. You've spent time with me today. So how are you going to take action with this information? How are you going to get the best value out of this organization? So what I would like you to do for yourself is to write down the one thing that you will start doing, stop doing, or keep doing as a result of this action. What are you going to do with the information that you learned today? Practice Management Nuggets is available as a podcast. If you are listening to Practice Management Nuggets podcast on Stitcher or iTunes or now on Radio Public, remember to subscribe to the podcast. When you like and comment on the podcast, it makes it easier for other people who like what you liked to find the podcast. Now, I want to remind you that I search for guest experts who will share their #1 tip for you. So let me know if there's a topic or a guest expert that you want to hear on Practice Management Nuggets webinars for your healthcare practice. Until next time, I'm Jean Eaton, your practice management mentor with Information Managers. If you like this episode, please subscribe to this channel and add your honest feedback to the comments below. When you leave your review, it helps people who like what you like to find this podcast. Until next time, this is Jean Eaton, your practice management mentor with Information Managers.